understand, why we have to take care of ourselves. So I'll just do like a quick speech and then we'll go from there. One of the reasons why I'm very passionate about health and also try to talk to a lot of women, it's because I think that naturally as women, we take care of everybody else but us. We are made to be nurturers, so we take things in. And we'd rather give of ourselves to other people than to give to ourselves. And so when you look at health statistics, some of the worst health statistics you see are in women. And it's because women don't go on time to go see the doctors. They accept a lot of things to be normal. Things that usually are not normal. They're like, oh, it's because of stress, or it's because it's my period, or it's because, I get these migraines all the time. But women tend to harbor things in until they get worse. The thing that is interesting with health is that when you look at the way a lot of symptoms present, what they teach us about how symptoms present, women statistically do not present with those symptoms as often. So let's say, for example, a heart attack. The most common sign that they say you have a heart attack is what? Chest pain, right? Chest pain is what people come with. My chest hurts, I don't feel well, and then they say it's a heart attack. But that is what 80% of men present with. Chest pain is seen in about 20% of women. So when women present with a heart attack, chest pain is usually not their first complaint. Their first complaint is usually tiredness and nausea and abdominal pain. So women present with a heart attack very differently. But a lot of times, because we are used to dealing with discomfort and certain things, there are certain things that we hold off. We don't deal with until things get worse. Sometimes when our patients that come to see me in the clinic or in the hospital, the worst lab results you ever see is in women because women tend to wait. But then also, naturally, in our healthcare system, we have a very paternalistic healthcare system in a sense that since when you look at healthcare, you have your doctors that have more knowledge than you, naturally, whatever they tell you, you listen. But then also, because of that, especially as women, what happened to my Zoom? Especially as women, when you go and you are trying to talk to your doctor and he or she shuts you down or says, you don't have to worry about this or don't ask too many questions, all of those things, we naturally just take that and we continue to deal with what we have. So a lot of times by the time a woman comes to see me with health issues, she has some things that you would see in your textbook that they'll say, like, this is the worst you can see. You see it in women, just because women just wait until things are bad. So I say that in the premise of taking care of yourself is very important and paying attention to your body. Now, how do you take care of your body when you don't know what normal should be for you, what your baseline is, right? So we'll talk about certain things, certain things that we shouldn't take for granted in our health and why those things are important. Number one is our heart health, of course. Your heart is a pumping organ in your body. Your heart is what causes everything else to function because it pushes blood and oxygen. Now, a third of Ghanaians have high blood pressure naturally. So over 30% of Ghanaians have high blood pressure. And out of that, less than a third of them even know that they have high blood pressure. So you have a lot of people that
Ian,
present blood pressure that has a
hello.
lot. Yes. Can I continue?
Yes, yes.
Okay. Okay. So you have a lot of people that present with high blood pressure, which is not good for the heart because it overworks your heart and it destroys your blood vessels. It causes kidney failure and things like that. So high blood pressure is one that you have to pay attention to. Number two, blood sugar, especially for us as women, especially women who have had kids. And the reason is that a lot of women go into something called insulin resistance, especially in your pregnant state. And a lot of times after you've had the baby, that insulin resistance state doesn't go back to normal. And so women continue to carry that, especially, I mean, most of us who've had kids, you realize that you have kids and it's very, very hard for you to lose that weight. It's very hard for you to, at first, if you do a little bit, that weight to drop. And now you're doing everything and you can't even lose 2 kilos. And it's because of that insulin resistance. Now, insulin resistance increases the risk for you to develop diabetes, and increase the risk for you to have high cholesterol and things like that. So heart health is very, very important. The second thing, the other part of apart if you take away heart health is mental health. Um, we tend to be in this society where stigma is very, very high. And sometimes I would say this in the best way, some of my worst mental health patients are Christian mental health patients because we don't, a lot of times, we have, of course, we believe that God did not give us a spirit of fear, but of power, love, and a sign of sound mind. But I also tell people that mental health is as real of a disease of like high cholesterol. Is as real of a disease as high blood pressure. If you had high blood pressure, your doctor said you have high blood pressure, you need to be on medicine. You take it. But then when you have mental health issues, all of a sudden there's shame, there's frustration, there's, more isolation, and there's a difficulty in expressing, what's going on to be able to get the help, to get medication or whatever it is that you need. And a lot of times when I'm talking to very strong Christian patients that I'm like, hey, we need to try medication, it's one of the hardest things for them to try because they don't see why they need that. They feel like when it comes to your mental health, if you have a positive outlook on life, or if you just change the way you think, it'd be better. Well, if it was as easy as that, then anxiety, depression, and all of those things wouldn't exist. Life is more than just that. It's a biological issue for some people, it's a chemistry issue for some people. There's some people where it's not like life has been bad to them or anything, but they just get depressed. And it's because there's something going on with their brain chemistry that makes them more prone to depression. So mental health is very important. Paying attention to what is going on in your mind. How are you thinking? And what's going on with it? Cancer screening is also very important. It says that, over 80% of Ghanaian women have not had cervical cancer screening. And this is Ghanaian women that are 30 and above, have not had cervical cancer screening, not even once. There are a lot of women that have had babies, have given birth, are married or whatever, and they have not had their cervical cancer screening. Meanwhile, cervical cancer is the second most dangerous or what is the word? Most leading cause of death with cancer in Ghana. And the mortality rate in Ghana is 80%. 80%. Over 3,000 women 2 years ago or last year had cervical cancer. 80% of them passed away. And it's not because you couldn't do anything, it's because they didn't get their screening on time. But then also, a lot of them get the diagnosis and then they don't come back. It takes the average Ghanaian woman with every diagnosis or whatever, especially when you have very bad diagnosis that your doctor has given, especially with cancer screening or with cancer, it takes the average Ghanaian woman to take from when she sees symptoms that something is wrong to see her doctor 8 months before she goes to see the doctor. And the cancer usually would change its stage from stage 1 to stage 2 to stage 3 and stage 4, which is the worst, every 3 months. So imagine that you were stage 1 when you found out that you found a lump in your breast. And you could have gone to see the doctor, but then you waited and you waited and you waited and you were nervous and you prayed and you did all the things I needed to do and you made everybody pray for you and everything, but you just didn't go and see the doctor. And then you wait 8 months. You've moved yourself into a stage 3. It's not the devil that did it. It is not your family members that did it. It is you. You didn't take the steps that you needed to do for God to give you healing through medical intervention so that you can be whole. And so sometimes that is one of the hardest frustrations. And that's why I'm very passionate about preventive care, because if you maintain your body the same way as you maintain your car or you maintain your house or you maintain even your AC. If you can maintain your AC and get your AC maintenance and get your car oil changed, but you don't do that for your car, which one has more value? Which one is more important to you? And so I'm very passionate about women getting their preventive health and a check for them to know what is going on under that hood of the car, what's going on in my body, how do I know what my baseline is, and how do I know how to continue to maintain it so that I can figure it out. And then when you know your baseline, you know whether am I good? Is that something I need to fix? And then you work on it. But if you don't know, how do you get anything done? I have people like, oh, they come and their blood pressure is through the roof. And as long as the last time I checked their blood pressure, and they're looking at you like, I don't even know what you're talking about. They don't know what it is. They've never checked, or maybe someone told their blood pressure was high, but they never did a follow-up, and things like that. So I'm very passionate about us being very, very serious about our health because I think that we take our health for granted and we blame everybody and everything and forget that we are the initiators of it. You have one life. I tell my patients all the time nobody can fight for you more than yourself. I can do what I can for you, but you deal with yourself 24/7. I see you for 30 minutes, 1 hour, and then you're out. But you deal with yourself, you live in your body 24/7. So if something is wrong, something doesn't feel right, and you don't vocalize it, you don't take the steps to make sure that those things improve, and then you wait until you collapse, you pass out, you have a headache, things are getting bad, then you start crying, and then everybody is doing all that. But then a lot of it, some of it could have been you taking those initial steps to prevent it from where it is. So that's it. In so hopefully the questions and things that we are trying to start, or the talk that we're going to have today, will help women to be more proactive, to be more interested in themselves. You have to learn how to do a self breast exam. You have to know your breast. Your husband shouldn't know your breast more than you. Is your breast on your chest? If it doesn't feel normal, how do you know when something doesn't feel normal if you've never felt it to know what normal is? How do you know if this is a lump or not? Because you're like, oh, I've never felt this before. So now there's something there. How do you know if you never get it checked? So you have to know your body. You have to be intimate with this body that God has given you because you only have one. And apart from the body you are living in, it's also the temple of God. You have to treat it with respect, treat it with dignity, treat it with love, treat it with care. Care for this body that God has given you so that you can live your longest, healthiest life. So that's my little spiel. So now I will open the floor for any questions that are related to your health, any questions, concerns. Doesn't need to be you, it can be your husband, your children, however I can help you today, I am open to do that. So that's my speech is over.
Thank you, Dr. Sumpa. God bless you so much. Okay, ladies, we have the floor. Today free consultation or any problem you have, please come and worry the doctor for us. Okay, so Dr. Sumpa, I think I'll start.
Yeah, sure.
With we women um who just entered our 40s,
Mm,
how um early should we expect menopause, and what are the symptoms, early
okay.
symptoms and all that? Thank you.
Okay. So menopause hits every woman differently.
Okay.
Now I would say average age for menopause is usually around 50. But woman, you can be in perimenopause or premenopause um, for years before you have that. Now, most women will start having perimenopause in their early to late 40s. But there's some women don't have it at all. Some of the risk factors is how early you had a period or how late you had a period. If you were someone that had a period very early, then your chances of having perimenopause is earlier, right? Than somebody who started having their period when they were much, like, maybe a bit later, like when they were 16 or 17 or 18. But if you were having your period when you were 12, 13, and things like that, then, you can only have so many periods in your lifetime. So then you have a much earlier perimenopause. Some of the things that you can notice is sometimes a woman just have all of a sudden feel very tired. They are more tired than usual. They don't have as much energy as they used to. They get easily irritable. Everything, like just small, small things get to you. All of a sudden, your husband every day, he never puts his clothes in the laundry basket, but all of a sudden it's like, Charlie, Like after 10 years, you've just had enough. You can't do it anymore. You're annoyed. You are just not having it. So you get easily irritated. Your kids annoy you. The people at work, they do certain things that just easily irritate you. You move from fine to you have these mood swings and they're just shifting all the time. Sometimes some women start having hot flushes. So they start feeling hot. They have this wave of warmth and heat that comes over them all of a sudden, and they are sweating. A lot of them have it at night. All of a sudden, the temperature is like the AC needs to be at like 16 because they get too hot, or they don't want to cover themselves with the blanket, or at night, you don't want your husband to even hold you because you're like, Charlie, I need to breathe. Like, just give me space. And so some of those things you notice. Some women also start having vaginal dryness. So when it's time when they're having sex, they realize that they need more, like maybe more foreplay time or maybe more lubrication just because it's more dry. No matter how much you try and everything, it's just more uncomfortable, it's more dry, and you need more help. I would say that those are probably like some of the most common ones. Now, sometimes you may also notice changes in your menstrual cycle. So maybe you were someone where you were like clockwork every single month. On the 8th of every month, you have a period. Now it's like to get to like the 12th, the 13th, the 14th, the 15th before it comes. And then so maybe you don't have it as regular and they don't last as long. So maybe your periods are not as heavy as they used to be. These of them lasting 5 days. Now they're only 3 days. Instead of you using maybe 4 parts a day, now you're using only one. And sometimes it's like you are barely, bleeding. So you notice that your blood is thinning out and it's becoming shorter. It's not as heavy and it's not as regular. And so those are the things that you usually notice with perimenopause.
Okay. So when it starts, what do you do? Do you
There's nothing to do, honestly. It's a phase of life, right? It's
okay?
your body that's saying that, listen, you have menstruated enough. Enough is enough. Now you have to, you need to start moving over to the other side. It's just a transition point. There's nothing wrong with going through perimenopause. Now, the only time that you need intervention is if your symptoms are affecting or disrupting your life. So if you're having vaginal dryness, we need to try maybe some kind of lubrication or some estrogen creams or something to help with the dryness. If you're having mood swings that is literally affecting your interaction with your husband, your children, your co-workers, like you're becoming depressed, you're becoming anxious, there are medications that can really help with that to get your mood more stable. If you're having the hot flushes, there are medications that can help. The hot flushes are just like, they're just so, I mean, Accra is already hot. So, Charlie, if you're having hot flashes and it's like, I'd rather go and stand outside at 12 p.m. in Accra, then medications can help. So that when you start noticing it, there's really nothing to do. It's just your body just telling you that there's something, there's just a change. And until it's disrupting your life, you don't need to do it. And I know sometimes women want to check labs and things like that. I'll say maybe the only lab that you want to check is to make sure you're not pregnant. Because sometimes when you're pregnant too, your body can just be weird. But
Yeah.
then the thing with checking labs, especially when you are not menopausal, is that women, because of our menstrual cycle, we're always going through cycles, right? So unless there is a main reason to check for hormones, if you're just having this perimenopause, which is a cyclical thing, the hormones don't really make a difference. So it may be normal, but doesn't mean that you're not having symptoms, no. And even if it's low and you're having symptoms, it's still that. So the hormonal checks and those things, yes, you can do it to give yourself peace of mind to make sure there's nothing else going on. But they don't really do anything unless you're trying to figure out if there's something else going on apart from just perimenopause, depending on your symptoms. But there's nothing really to do unless the symptoms are worrying you so much that they need intervention to help you to, live your life.
Thank you.
You're welcome.
Doc, I have a question.
Mhm.
Does anemia affect menstrual cycle?
I would say that it could be that the menstrual cycle is having effect on the anemia, but it could be the other way. Now, a lot of women naturally when you see anemia, a lot of women who are having their menstruating women will have anemia, especially if you have heavy periods. Now, if you have very heavy periods or you're anemic and you don't deal with it, you make your system worse. Now, a lot of times when you see that when I see people have anemia, people take it very what is the word? Very lightly. But anemia is a very dangerous condition. And it's dangerous in the sense that imagine that, in our body, we have about 7 liters of blood in our body, naturally, average human being. Now, your heart needs to pump 7 liters of blood throughout your whole body, and it has a rhythm for pumping that blood. Now, you are anemic, and now instead of you having 7 liters, you have 5 liters or 4 liters. You are telling that heart to pump harder to give that same volume of blood per second or per minute to your body. So, what you're doing is that you are forcing your heart to overwork itself. You are forcing your heart to overdo what it shouldn't do because your heart was not made to pump at a higher pressure and a higher pace, right? So when you have anemia, you are driving your heart into overworking itself, and eventually anemia can cause heart failure. It can cause a lot of bad heart rhythms and irregular heart rhythms and stuff, especially in women. One of the leading causes of heart failure in women is untreated anemia because they wait. Oh, the doctor says I'm anemic. Oh, the doctor says I'm anemic, but nothing is happening. It can also cause kidney failure and things like that, especially if it gets really bad because you don't have enough blood. So if you don't have enough blood, you're not giving your organs enough oxygen and they will start to have issues. But apart from that, your heart is now also having to overwork itself to give your organs that same amount of volume per minute so that your organs don't suffer. So a lot of times anemia may not necessarily be affecting the period. It's the period that is causing the anemia. And it will continue to make it worse, especially if the reason is that you have very heavy periods. Have I answered your question?
Thank you. Yes, you have.
Okay.
Thank you.
Okay. Okay. I think Adobia has a hand up.
Dr. Sumpa, please, I would like to know, is it advisable to have a pap smear if you are menstruating or pregnant? Is it advisable?
I mean, you can have it when you're menstruating. It's just that it's just uncomfortable. For some women, when when they're in their period, they're just more sensitive. Their vagina is more sensitive and things like that. So they don't necessarily want it. Usually I tell people if you're past like your first 2 days where you are not having very heavy bleeding, you can have a pap smear. It's fine. When you are pregnant, we usually don't do it past a certain stage, just because first of all, it's just very, very uncomfortable, and it can irritate the cervix, especially if you are in a more advanced stage. You can almost like it's almost like you are stimulating your cervix, and it can put you into preterm, labor. So, but usually you can do a pap maybe like in the first trimester, but after that, you can just wait till you finish having the baby.
Okay, thank you.
You're welcome.
Hey, ladies, ask questions. So, few consultations.
Another one, Dr. Sumpa, please.
Yes.
Ask everything. Adobia, ask everything.
With the wellness, if you are being given medication, do you stop at a certain stage or it's something for a lifetime?
It depends on what you're being given medication. So being given medication like for what?
For maybe depression, stress.
It depends. So usually when I do a lot of treatment for mental health. So when I give somebody medication for anxiety or depression, we have to figure out first of all, why are you stressed? Now, if it's situational, let's say that we are giving you medicine because you lost a family member and it has really like completely thrown you off. You don't know how to handle yourself. After like a year, we can get you off because you are now, you are still grieving, but you can manage the grief better. You've gone through therapy and stuff like that. But there's some people who just naturally cannot they just have anxiety and depression. they have a lower threshold for handling, stress, but it's just chemically, biologically, that's just the way they are. Now I tell people, if you're taking medicine that makes you feel better, that makes you think clearer, that makes you feel like yourself, why do you want to stop? If that medicine is actually helping you to achieve the goals that you want in your life, why would you want to stop that medicine? It's working. So it depends. It depends on the situation. Now, I always tell patients my goal is not always to put you on medicine for the rest of your life, but I also treat everybody personally because everyone's situation and case is different. And I have some people who they'll be on it for like a year or two, and they're like, listen, I want to try and come off. Sometimes we may reduce the dose. Sometimes we'll try and come off of it. I have some patients that we come off of it and they're doing great. And I have some patients where they come off of it and they're like, the symptoms are coming back again. And then we realize that then they need to be on it long term. So it depends on the situation. It really depends for everyone. Even the same thing for high blood pressure. If I put you on high blood pressure, doesn't mean you need to be on it for the rest of your life. If you're on high blood pressure, where you're like, I have a family history. My mom and my father had high blood pressure. I'm doing everything I need to do, but my blood pressure still cannot be managed. You probably need to be on blood pressure for the rest of your life. But if you have high blood pressure and you are obese and you have high cholesterol, you're not eating well, you don't exercise, you're very overweight, and all of those things, then that could be causing the high blood pressure. So while we give you the medicine to manage your diet, and manage your blood pressure, we're also going to do things to get those changes to we're going to do those changes to help you lose weight, to help to do all of this so that you may not need that medicine again. So it depends on what you need it for. I think she got off the thing, but yes. So
I went off, sorry.
So I
I'm
was
back.
saying that where did you and where did it? So I was saying that let's say you have high blood pressure. If your high blood pressure is because you have a family history, you have a genetic predisposition to get high blood pressure, then your need for high blood pressure medicine for long term is there. But if you have high blood pressure because you are overweight, you don't eat well, you're eating kinky and wache every morning. In the afternoon, you're eating fufu, and you kill it with banku. And then you don't exercise. You eat a lot of salt. Kobe is your best friend. All of those things. Well, no wonder you have high blood pressure. So if you say that, so usually if somebody's high blood pressure is because of lifestyle choices, what I do is that I will still put you on high blood pressure medicine because we need to get your blood pressure down. But then we will aggressively try to improve those risk factors and those other things that you're doing that are causing your high blood pressure. So we work on helping you to lose the weight. We change your diet. We start exercising. And if all of those things get better, then we can slowly get you off that medicine. So it depends on what's the history behind your diseases.
Okay, thank you.
Yeah. Yeah, you're welcome. Yeah, Megan.
Okay, so a question from one of our members. She wants to know, a lady friend has severe abdominal pains and waist pains before her menstrual cycle, and she is allergic to painkillers. What is her next option to endure this always?
Okay. So, first of all, I think I did a video not long ago to let people know that if you have severe abdominal pain or back pain, during your period of few days before your period, it is not normal. It is never not. It's not just a pain problem. So you need to figure out what is causing the pain. Because if you don't figure it out and it is a bad issue, like something like endometriosis, it will actually get worse. And it's not life, it could be life-threatening depending on where the tissue, connects to your body and stuff like that. But it is a very dangerous problem. So first of all, if you're having very severe pain, it is not okay for us to just go over it. It's not Eve's fault. It's not any of those things. We should stop blaming Eve for having severe period pain because it's not normal. It's true. We blame Eve too much. I think she has suffered enough. So having that kind of pain is not normal and it
It's
never
false.
is, right? I'm telling you, you have struggled. So it's not normal. So first of all, you need to figure out why you're having that pain. Secondly, when people say that they're allergic to painkillers, I always want to ask what painkillers, because there are several classes of painkillers, so many options. So if somebody says you're allergic, I think that is because maybe they've tried one pain medicine that made them feel ill, and now they're like, I'm allergic. Painkillers are not just in one group. There are, I shouldn't say thousands, but there are tens of options. And so there is an option for you. There's you can't be allergic to every single painkiller that is in the market. And it may be a group of painkillers, maybe you're allergic to opioids. So you can't do morphine or you can't do things, but you can do non-steroidal anti-inflammatory like ibuprofen and naproxen and diclofenac, or you can do analgesics like paracetamol, and or you can do tramadol, you can do gabapentin. Like there are so many options depending on what it is. So you can't just have an allergy to painkillers. So I think that that person needs to see a doctor, get that person to fully examine them, get that person to get their history to see what is working and what doesn't work, and then they can come up with a plan. And also somebody that can help them to figure out the cause of their pain and of all, like see the history and help them to figure it out, because it's not okay to be in pain, but it's not enough to just say you're allergic to painkillers. There's something else going on. Sorry.
Thank you.
You're welcome.
Any more questions, please?
Yes, Roberta.
Hi, Fasumpa. I didn't join early. I'm not in the jurisdiction, so
No
the
problem.
timeline, the time zone don't. I just wanted to find out for those of us in the diaspora, I follow you on the page, but I'm not in Ghana, but I think that you are deep, and you know how it can be to get medical care here, even though they say
Yeah,
it's really not that accessible. Sometimes
yeah,
you want someone to speak to really
yeah.
delve into a deep conversation with. Do you have services for maybe teleconsulting
Yes, yes,
and
we
you can
have
become a family
telemedicine.
doctor
Yes,
I
yes,
mean
yes.
for me.
So, yes, we have. Oh, please, I beg you. So we have telemedicine. We do telemedicine consultations as well. Because I do have a few patients like that who are like, I just need somebody that can help me while, I'm outside the country, and I can help to facilitate that as well. So yes,
Okay.
we offer telemedicine.
And how do I sign on or
I can, so let me see if we have the chat. I can put our websites. Hopefully it is going to everyone. DynaGirlMed.com. So once you go to the website, there's a schedule appointment
okay.
link. And then once you do that, you just once you schedule, we'll call you, and then you can, I think there's even a comment side where you can just say telemedicine, and then we
Okay.
can do that. Yes. Thank you.
Okay, thank you.
You're welcome. So
Please, doctor
where are
is
you?
waiting.
Roberta, where are you?
I'm in Canada.
Oh, okay. Okay.
Mm.
Okay, Dr. Sumpa is waiting for questions. So, hey.
Maybe everybody is, healed and doing
Eh,
great, living
yo,
their best life.
yo, you go and pay for consultation. You better be asking your questions. So, okay. So, is it safe for a woman after 40 to have kids?
Hmm.
Thank you.
So, yes.
Ah,
So, um, you can have kids if you are 40. There is a much higher risk of complications with that age. So, in the obstetric world, we have something called an advanced maternal age. Now, advanced maternal age is when you're 35 and above. So, when you're 35 and above, your risk of having any kind of complication is higher. So your risk of having a child with Down syndrome or some kind of genetic issue is higher. Your risk of having high blood pressure, a condition called preeclampsia, postpartum hemorrhage, diabetes, and all of these complications during your pregnancy is much higher. It doesn't mean that you can't do it. I mean, there are people you've seen hear all kinds of stories. It's just that that risk is higher. So you have to weigh that risk and see whether it's something that is worth, going through that. But then there's nothing wrong with getting pregnant at 40. I wouldn't advise for you to have a child at 48 or 49 if you're still having your period. But I mean, if that's what you want to do, go ahead. But as long as you're having a period, you can get pregnant. Yes,
Dr.
Josie.
Sumpa, okay.
Yes.
Please, can you be pregnant and be menstruating as well?
So there's some women that would have bleeding where they think they were menstruating. I mean, you've had all kinds of stories, but I think that for the most part, lots of times women are having bleeding. So you can have like implantation bleeding, or you have something called subchorionic hemorrhages. So you can bleed. It's not necessary. You're not having a period, because a period requires you to have the whole lining of your uterus to be cleared and to be thrown away. Well, that baby is connected to that lining. So you can't have a period. But you may be having some bleeding that, because you didn't know that, you maybe have some bleeding that you think may be related to a period, but it's not. Oh, we're ready. Hold on. So, yes. Yes, Josie. Sorry.
Hello, good evening.
Good
Evening.
evening.
Yeah, is it normal to be having severe abdominal pain while you are ovulating?
While you're ovulating,
Yeah,
is this something that happens all the time?
yes, but it's severe.
Yes. So, no, it's not normal. Now, some women will have discomfort. A lot of women don't feel when they're ovulating. Some women know when they're ovulating. But then if you're having severe pain, it's not normal. It's not normal when you're having severe pain. It could be something that is going on, like I said, something like, so there's a condition called endometriosis. Endometriosis, please give me 1 second. Joy, why were you beating David? Don't do that again. Do you hear me? Listen to me. If you do that again, you'll go home. Okay? No, do not hit anyone. Okay? Do you hear me?
He was
Shh, 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 shh. Do not.
your status now.
No hitting.
Everything that I have, and he wants it. He always snatches it from me.
Okay, but he's 3. Okay, and how old are you now? You're 6. So please, no hitting. Okay? Be nice. Okay. So there's a condition called endometriosis where the lining of the uterus moves away from the uterus and connects to different organs in your body. So it will connect to your ovaries, can connect to your fallopian tubes. And that usually, when that happens, women struggle with fertility. Because they have scarring the fallopian tubes. It can connect to your bowel. So some women will not have just pain, but they have very painful like bowel movements when they are having their period and they are pooping. It's horrible. It's hell. Some women have very painful like urination because it connects to their bladder and all kinds of stuff. So sometimes, I'm not saying that's your case, but sometimes when women have endometriosis and it's connected, it goes and implants on the ovaries, they would have ovulating pain. They actually know when they're ovulating because the lining, when you start ovulating, that lining of your uterus is starting to grow and proliferate. And that is literally the same thing that is happening to that tissue as well. And so then they can notice when they're having that, like when they're having issues. And so that's why that is important. Please give me 1 second. Okay, so tell them that they have to go. Okay. Okay, thank you. Yes. So, but that kind of pain, it could be a cyst. Some people develop a lot of cysts as well that can make them have pain. But it's not normal. I think that one of the things that I think has been one of the worst things in our medical, especially for women's health, is when we make it seem like pain is normal. Pain is never normal. Pain is your body telling you that there's something wrong. So it's like your body saying that there's something wrong, and you're like, oh, calm down. Like it's not that bad. You need to chill. But your body keeps telling you that, listen, there is something wrong that you need to pay attention to. And the only way I can give you attention or show you that you need to give me attention is to give you pain. Because pain means that there's inflammation. Everything is going haywire. Your cells are releasing all kinds of what we call cytokines and things to let you know that there's something going on here. And then we are like, oh, we have to go through it. It's not normal at all. So you need to see somebody that can evaluate you. You need to do probably some scans, a physical exam to see what's going on. And because you can't live your life that way. I mean, you have a period every month until you are, let's say if you're going to, until you're 50. How many more years are you going to suffer?
Hmm.
But so if you go and see the doctor and then they tell you no, it's because you're ovulating, but you keep on insisting that nothing has been done
Then
about
find
it.
another doctor. That is
Yeah.
why there's
Dr.
more than one
Sumpa.
doctor in find a doctor. And it's one of the most frustrating things when you go to someone for help, right? And the person is not helping you, or the person, have they left? Have they left? Okay. And the person is not helping you and stuff. It can make you feel very helpless and make you feel like, then why are you bothering? But you have only one body. This is the one body that God has given you, and you are the only one that gets to live in it 24/7. So if something is wrong, then you need to see someone. And if that person keeps saying that there's something, then go and see someone else. But you can't keep seeing the same person, expecting the person to give you a different answer. If that person is saying that there's nothing wrong, and they're not willing to do anything to go beyond that to help you to feel better, then you need to find someone else. Plug it in well. Try. So you need a second opinion. You need a third and a fourth and a fifth. But there's something wrong, Josie. So you need to see someone who will listen, somebody that is willing to get you through, was willing to advocate for you, and is willing to, do whatever it takes to get you to where you're feeling better. That's fine. I'll deal with it. I mean, close my door, please. Thank you.
Thank you.
Yeah, you're welcome.
Dr. Sumpa,
Yes.
please, is it true that every female has fibroid?
No. Not every
Who can
female.
lie?
Who said every female has fibroid?
No, sir, overheard it. I overheard it somewhere, but I can't remember that every female has fibroid. So those whose fibroid become big seems is feeding on the blood in their uterus, something funny. So I was uh,
So not
it got me
every
confused.
female, not every female has fibroids. Um, Women from African descent, so we have some black blood in us, our because of genetics, we have a higher tendency to develop fibroids, but not everybody has. But a lot of women will develop, a lot of African women will develop fibroids in their lifetime. Now, most people will have a fibroid that doesn't bother them. And some of them will have the fibroids that grow bigger and stuff, especially if you started having fibroids when you were very young. So if you were in your 20s and you have fibroids, by the time you're in your 40s, that's a 20-year-old fibroid. Like it might get a little bigger, right? But then not everybody has fibroids. Not everybody, if that is it, then like we're in trouble. So not everybody has fibroids. No. Also, fibroids they don't feed off blood because they are not vascular structures. They are just growth within your uterine wall. So they are not taking blood from anybody. They are not doing, no.
So
So they are
So,
how come?
they are just genetic, like, or how do they
so yes,
happen?
yes. Fibroids, a lot of them are genetic and also hormonal. They say that African women just have more sensitive hormone receptors and things like that. And so because of that, we are just more prone. That's why African women are more curvier. We are more, our structures are different. We have more, hips and more breasts and all of those things. But all of those also increase our risk for us to have more fibroids, increase our risk for us to have breast cancer. Women in sub-Saharan Africa, we have the highest risk of breast cancer, and also we have the highest risk of getting the most aggressive cancers. God has blessed us in this Ghana with, so it's not Eve. This one, you can't blame Eve. This one, who do we blame? But our risk is higher. So we have a higher risk, but that doesn't mean that everybody has it. But it's all genetics. Okay.
Olivia, you were saying
That's when
something.
it grows and becomes like,
Sorry, what were you saying?
oh,
Hello?
Yeah, we can hear
because
you.
of our hormones, that comes big. Could it
Yes,
be
so it's a hormonal thing. It's also a genetic thing. It's the way our genes are, it's the way our hormone receptors are, and things like that.
so? Do you have an operation? Can it come back in?
The
Can it
fibroid.
grow?
A lot of women, once they have that fibroid removed, now there's some women who, once they have that fibroid removed, they don't have issues, or maybe they'll have a few more growths. But then it's not as big as that big fibroid that they had. So when you're having fibroid surgery, you have to be able to weigh it out and see, why are you having that? Is it because it's causing you pain? Are you just doing the fibroid because the doctor said, oh, I see a fibroid? Or are you seeing the fibroid? Are you doing the fibroid surgery because it's causing you pain? Or are you doing the fibroid surgery because you're trying to have a baby and you keep having miscarriages because this fibroid keeps, pushing on the baby? So there has to be a reason. You don't just do fibroid. The same way, like I came to Ghana and I realized that doctors actually give you an option between C-section and vaginal delivery. I have never heard of that before in my entire life, because you don't just do surgery for fun, right? There has to be a reason for it, and the risk has to be less than the benefit. Like the benefit has to outweigh the risk. So anytime that somebody wants to do surgery for you, there has to be a benefit that is much higher than the risk of you putting yourself under anesthesia for surgery and the risk associated with after you have the surgery. So you can have fibroid surgery, but the reason it has to be worth it. If not, the reason why I say that is that in Ghana, if you go to any doctor and say, I want to have surgery, they'll do it for you. I don't know why. They just do it for fun. So you have to be, there has to be a reason. It has to be causing you discomfort or affecting your life in some way to be worth doing the fibroid surgery.
Okay. Thank
I know
you.
there's something like a multiple fibroid, and my auntie and my mom had one, and it just made them bleed a lot during their menses and all that. And they had that surgery on that thing more than once because they have it, and after a couple of years, it grows back. So
Mhm.
finally, they had to take it out with
Take out the uterus.
the
Yes. So there
uterus.
are some women like that. And there's a celebrity recently that posted, Lupita. Lupita posted, I think about a month or so ago, and she did a picture holding all her fibroids, basically.
Mm.
She was holding all these fruits. I don't know if anyone has seen it, but like she was holding like these like a ball of so many fruits, and all of the fruits represented all the fibroids she has had in her life, all
Peter,
the huge. Some of them are huge. Some of them, like one of them was like a size of like a melon. The other one was like some were like
the
size
same
of grape.
Lupita, the same Lupita.
Lupita, yes. So she was
Hey,
just talking about how like she's had so many fibroid surgery. She suffered a lot in her life. It has cost her a lot of things and all of that. And she just one day decided that she was going to talk about it because fibroids are things that people don't talk about. So there's some people like Lupita that will have like multiple fibroids over and over and over again. For someone like her, she probably hasn't removed her uterus because, or maybe now she's done it, but maybe she didn't do it a long time ago because she wanted to have a child,
mm,
right? But then there's some women where the doctors are like, listen, we keep doing this surgery or this keeps happening over and over again. It's better to just
take it
remove,
out. Yeah.
take the uterus out so that you don't keep having these issues, especially if you're like, you don't want to have any more kids or you're not interested in kids or, you know, give me a
Yeah.
sec. Yes. Okay, Roberta.
Hi, sorry. So I just wanted to ask that, usually they say when a woman gets to 40, it's like all of a sudden you need to start taking care of yourself. There's premenopausal syndrome and all of that. How true is that? And what exactly, once you hit 40 as a woman, is there anything health-wise that you need to start doing? You need to stop doing because it looks like 40 seems to be a big deal age.
I think I want to dispute that fact and say that at least when a woman hits 25 or 21, she has to start taking, you have to be more serious because cervical cancer starts at 21, right? 40, I think is too late in the sense that, let's say for breast cancer screening, for example. So there's a campaign, World Health Organization says you should do it at 40. US says you do it at 40. UK, Canada do it at 40. Now, all of these organizations are people who did research on non-African women, right? The average presenting time for breast cancer in African women is 35. So we have a larger presentation of women that have breast cancer. I have about 2 or 3 friends at least that have been diagnosed with stage 3 breast cancer. So, and they were less than 40. And so that age of 40 screening doesn't work for us, right? Because we are at a much higher risk. We should be doing breast cancer screening at 35 because, or even at 30, because that risk is much higher. And so I think that you have to start all of these preventive measures when you are much younger. Now, of course, when you're 40, your body, because of the possibility of entering into perimenopause, your body just starts to be different. You know, I tell people when my husband turned 40, that day that he got out of bed on his bed, I was like, God, I'm in trouble. Like all of a sudden, the man is squinting and squeezing his face. I'm like, what happened? Did God beat you during your sleep, or what happened that you can't get out of bed? All of a sudden, I was like, happy birthday. He has done his face some way. And this, I think that something happens. I don't know. I don't think I think that is psychological because there are people who are living their best life and they have no issues and they're 50, they're 60. But I think that the earlier you start taking care of yourself, the lesser the effects of this aging process is less harder on you when you take care of yourself earlier. So I think that 40 is actually too late for you to start thinking of taking care of yourself. When you're 21, you should be having a pap smear every 3 years. When you hit 30, you can do a pap smear every 3 years or every 5 years. When you hit 40, they say you should do breast cancer screening, but you can start breast cancer screening early because when you do your wellness every year, your doctor should be doing a breast exam. You should be doing a breast self-exam every month when you have your period. You need to be doing at least once a month. You can do a breast ultrasound from age 30 if you want every year. And so a lot of it is also looking at that, looking at your family history and all of those things to see. I think that 40 is too late because 40 is just 10 years shy of 50. I think 50 is when you're like, okay, things are changing. Your things drastically change hormonally and all of those things physically. 50 is when you start to notice it more than 40.
Okay, so what are these changes that you need? So maybe lifestyle, maybe are there certain foods you should stop eating? Is there
I think
anything that like,
so.
yeah.
Lifestyle, of course, exercise is very important. So you should be walking. You should be exercising at least 150. Give me a second. Joy, yes. Joy, what did I say? I'm busy. Can you please go? Netflix is not important. Please go. Thank you. So you sorry, my child distracted me.
It's okay.
So you should be exercising at least 150 minutes a week. So that is like exercising 30 minutes a day for 5 days, right? So exercising to where you feel like you're getting your heart to work. When people say, I'm going for a walk, and their walk is like a stroll. That's not exercising. We are not strolling here. We are exercising. You have to walk fast, walk briskly, get your heart moving. The kinds of foods that we eat. So sometimes when I say this, people get upset or whatever. So say it. Now, food is fuel. right? Food, I tell people food is medicine. If we see food as medicine, we wouldn't need a lot of the things that all these supplements everybody's throwing into their mouths. And when God has given us food to be our medicine. So food is fuel. Now, for me personally, I won't say for anybody. For me personally, my bad fuel is banku, wache, fufu, kinky. I can't eat it because fuel is supposed to give me energy. When I eat food, I'm supposed to feel better. When you put fuel in your car is supposed to move. Your car is not supposed to stop 30 minutes and go to sleep. If you eat and then 1 hour later, you cannot do anything with yourself, you need to turn on the fan, turn on the AC, go to bed, you are just completely out, you feel so slow, then that food is not your fuel. And a lot of our diet leans more toward that kind of food, the heavy carbohydrates and the high fats and the high salt and the high sugar. And we eat a lot of that, and it really it's not helping us. It's causing us to gain weight. It's causing us to have brain fog and get tired and have bloating and all of those things. So I think a lot of it plays into our diets. The kind of the ramen and the indomie that people eat, and the margarine. Margarine is one of the worst things you can eat in your body. It's so bad for you, but in Ghana and in our part of the world, we market margarine than we market butter. If you go to developed countries, you don't see them eat margarine because margarine is horrible for your health. It increases your risk of heart disease like by triple. But we eat all of these things because they are not good for us. And so they are causing us a lot of harm. So paying attention to the food that we eat, I think is one of the most kindest things we could do to our body, to be aware of what we eat, how we eat, when we eat. Eating too late is not good. Have you ever noticed that when you eat so late, the next morning you are so hungry because it's just not good. It puts your body in a very bad, state. So yeah, those are the things. So exercise, diet, and then also just being very aware of your preventive health, your cancer screening, your yearly labs, knowing what your cholesterol is, what your A1C is, what your blood pressure is, and all of those things, where your weight is, and whether you're at a healthy weight or whether you need to improve. And I say that because I struggle. I struggle with my weight a lot, especially after I had my children. I tell people my first one, I could release the fat. Second one, my body and fat started becoming friends. Third one, my body and fat became best friends. Like literally, the fat didn't want to leave. And so out of my frustration, I started figuring out what is going on. I realized, what insulin resistance is and how to help to manage my insulin resistance. And it has helped me to lose more weight and be much like careful about what I'm eating and help other people to deal with that as well. Because the weight gain it's a huge problem. And especially after you have kids, and a lot of us can testify, you don't know what happened, but that fat, especially the one around the stomach, is like, it doesn't want to go. It loves you. It wants to be your best friend and die with you. It doesn't want to leave. And so and so, it's a struggle, but there has to be an attempt to always want to make those good choices to, live as healthy of a life as we can.
Thank
So
you.
you're welcome.
A lot.
So what should we eat?
So we have to eat less carbohydrates. We have to eat more protein, more vegetables. So one of the things I talk to my patients about, and I try and do if I can remember, two things. One is mindful eating. Mindful eating is, as I'm putting this food in my mouth, do I need to put it in my mouth? Because, naturally we have a habit of, I remember I used to do this a lot. I don't do this anymore. But I used to always eat my children's leftover food. I don't know if a lot of you can. Like, you eat the food when you are clearing it. So by the time you realize you're eating their chicken, you don't even know why, but the food is entering your mouth. You are just eating, right? Randy, we suffer. So I don't know if any of you women can testify, but I know that was a struggle for me
Yes.
because
Yes.
your husband, you're like,
We see it
this
as normal.
is good for you. You didn't eat the food I've given you. Like you've suffered to cook the food and nobody wants to eat it. So by the time you realize you are eating it, as if it changes, and so like it was a lot of that, but it was also a lot of like sometimes when I'm stressed, by the time I'm realized I've cut a slice of bread. I'll eat one bread and I'm like, Charlie, this bread, this time, Charlie, the bread was so fresh. So I'll go and bring me another one with butter. Put the butter on laughing cow. Then you go and add your, Charlie, today if I add some yogurt, it will be bad, cry. Then you add, yeah, eating it at 8 p.m. And you're like, why? So I had to start asking myself, why am I eating this food? And do I need to eat it? And it changed a lot for me because I had to always like think about it all the time, especially when I'm not eating at the time that I should eat it. Because sometimes I was like, I'm not even hungry. Because when I finish eating, now I feel bloated. I feel, and it's like, so why am I eating? Also, like, when we have a culture of people going for second round all the time, you don't need a second round. You won't die. You're fine. It's true. And I'm saying these things because I have personally struggled with it. So when I say it out of a place of experience. You don't need a second round. So I started asking myself, am I satisfied? Because you eat to be satisfied. You eat to deal with not being hungry. You don't eat to be full. Because once you are full, you are uncomfortable. And some of us eat until it's like your stomach, you have to open your trousers. You have to,
Especially fufu.
Charlie. Yeah, eating the food, and you're like, why, like, was this necessary? Like you could have eaten half of that fufu and you'd have still been fine. Then you eat the food and you add your meat. And if you're eating your meat, you have to add every single protein that you put inside that soup. You have to eat it. So you have to have one goat meat, you have to have one fish, you have to have one crab, you have to have one snail, because you made the food, so you have to eat it. And the food looks so delicious. But you have to start thinking about eating to live and not living to eat. And some of us live to eat. We always have to go for second round, even when you are full, as if and we have that culture. When you go to someone's house and you do, so why did you eat this small one? They always want to give you second. So we've learned that culture a lot. When people don't eat a lot, we are like, hey, why wouldn't you eat?
What's going
We
on?
dish. Yes, what's going on?
Don't you like the food?
Yeah, don't you like the food? Some of us, even there's a lot of us who are corporate. Our husbands, before they met us, they were healthy, they were slim, they were living. Then we have packed the food on them. We have given them food. We made them eat, and now they have
A lot
pot
of
bellies.
meat,
Now they are
protein.
struggling, and now they've increased in size, and they are tired, and they are having back pain and stuff. And we are part of it. We gave them. They could have said no, but they're eating it because we said.
We serve them the best meat.
Yeah, and then we also give them the best fat and the best of
Yes.
heart disease and the best of diabetes. So that is what we also do. So
Yeah, so
the kinds of food, so less carbohydrate, more protein, more vegetables, those kinds of things. When you look at your plate, divide your plate in half. Half of your plate should be vegetables. Half. One quarter or let's say half, yes. So half should be vegetables. A quarter of it should be your protein, right? And the other quarter is your carbohydrate. Now, if you go outside of our African,
Half is vegetable, half
yes,
kwa.
half is vegetables,
why would
quarter
Roberta
protein.
put the vegetables in the bagu? Where? Which side?
She has to figure it out. So that the dish soup, okra with Elizabeth. So now, when we look at our culture, right? When you look at the way our culture is, I remember when I went to this and I realized in the US, the protein is the main meal. So when you choose a meal, when you go to a restaurant or whatever, your main dish is the protein. And then your side dish is the carbohydrate. In Ghana, it's not like that. In Ghana, when you look at our menu, the main dish is the carb. That's the
Exactly.
food is the carbohydrate. And then
Jollof.
our protein and yes, jollof with then side is fish, chicken, snail, So we have flipped the plate and we have to bring it back because it's not helping us when our carbohydrates are so high. Carbohydrates, when carbohydrates enter your body, they tend to sugar. And then your body takes that sugar and stores it to fat. So all the food that you're eating is turning to fat. It's not fat that converts to fat, it's carbohydrate that turns to fat. So less carbohydrate, more protein and things like that. Also, I tell people to avoid foods like one of the worst things or one of our bad things that we eat, margarine. Now, I tell people that if you look at the concept of margarine doesn't melt,
Blue
right?
band.
You can leave
Sorry,
margarine outside.
please question.
Yes,
Please, is Blue Band margarine?
yes.
Yes.
Eh, way.
Blue band is one of the worst things you can eat. And it's because when you look at margarine doesn't melt in room temperature, right? If you leave, you don't need to put margarine in the fridge. Margarine will never melt. Margarine will stay there. Margarine and palm oil, they actually become harder. Palm oil will coagulate and get harder in room temperature. Now, I tell people that if margarine is doing that, imagine what margarine is doing in your body.
Mm.
Yes. It's coating your blood vessels. It's
What a
literally
shock.
coating it's not what a shock. It's true. It's literally coating your blood vessels and it's doing that over time and it's building over time and it's building over time and then eventually will clog those blood vessels. And that's what margarine does. So margarine is not good for you. And palm oil also does the same thing. You know, some of us, we don't
Hey,
even our regular stew is with palm
Oh,
oil. Everything is palm oil. Yes. Look at what palm oil does in room temperature.
but I thought they said palm oil is good, it's healthier than
for eyesight.
Who said that?
that's what they
Oh,
say.
in
When we were
what is
growing
it?
up, that is
When you're
what the
growing up,
doctors say.
That
learning
is what,
the
but was it
vitamins.
a doctor that said it or it was somebody that,
Their
the same people that
parents.
said that
Their
when you're constipated,
parents.
the people that
Their
said that when you're
parents said
constipated, you should
it.
put ginger inside your butt for a constipation. These are the same people
Eh,
that said palm
eh,
oil is good for you.
hmm. Our teachers have taught us wrong things. They should
So,
give us our school fees.
Dr.
Yes.
If you say you're eating bread with margarine and you have this hot tea, won't the tea melt the margarine?
Well, thank you.
You wish.
But the margin is still going to go back to its natural state.
Mm,
It's a very
mm.
saturated fat. So it will go back and it will literally, it coats your blood vessels.
But
So
as well,
margin is
please
not good.
question. So you are saying that let's say you're saying we should eat if we're on a plate, we should have half of it should be veggies and proteins there. So let's say you decide that you eat once a day. Can you then gather all the carbohydrates for the day so that you
No,
fill it in
no,
the
no.
one?
So the next thing that I'll say, so the reason why a lot of Ghanaians have insulin resistance. So insulin is a hormone that is supposed to drop your blood sugar. Whenever your blood sugar goes up, insulin goes up and drops it, right? So when people have diabetes, their blood sugar is so high, so they have to take insulin. So think about this. I tell people that it's like us and our children. Every time that your child does something, you shout. As your child does more things, you shout more. At a certain point, your child is not scared of your loud voice anymore, right? Your child doesn't
Mhm.
listen.
I
And so now
mean,
you feel like you need to shout higher for your child to listen to you. That's what insulin does. Your body keeps going sugar, sugar, sugar. And every time insulin also has to respond and say, go down, go down, go down. At a certain point, the body doesn't listen anymore. So insulin feels like it needs to go up in order to get the body to drop that blood sugar. The problem with insulin is that insulin is a fat storage hormone. Insulin takes your sugar in your blood, takes it into your cells, and the ones that your cells don't use, it will store it to fat. So if you give too much sugar to your body, you are putting your body into too much insulin and insulin resistant state because insulin is going to keep go up. And then because of that, it's going to store to fat. So one of the reasons why Ghanaians struggle a lot and why our diabetes and things is high is because of our diet, especially at breakfast. Because imagine that you were fine, you haven't eaten, so your blood sugar is low, right? And then all of a sudden you eat wache. You went from zero to boom, blood sugar. up through the roof. What you are doing is that you're making your body overwork itself to produce so much insulin to drop that blood sugar. Are you getting what I'm saying? So if you do that all the time, in the morning you eat kinky. In the morning,
Okay,
Ghanaians.
Asamo.
In the morning, you eat kinky. In the morning, the slice of your bread is half the loaf of bread is what you eat your breakfast with, plus 3 eggs, plus Milo,
Hey.
which has sugar in it. Or you have your tea and you put 3 cubes of sugar in it. All of those things, you're overloading that body that had no sugar all of a sudden from 0 to 100 all the time, all the time, all the time. Ghanaians can carb load. I mean, we people eat sometimes and are like, wow, how does a human being eat this? But what we are doing is that we're overloading the system over and over and over again. And so, yes, you can, people say, oh, I eat only once a day. It's actually one of the worst things you can do because you starve the body. Your blood sugar is low, 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 low. Then 6 p.m., you lock it, you go up, you are eating, you add, you load everything. You're putting your body under a lot of stress to produce so much insulin to drop that blood sugar because your body went from 0 to 100. So it is better to keep your body in a more steady state where you're eating small. That's why people say you should eat smaller meals. You put your body in a more steady state of eating like smaller meals and things like that during the day so that insulin doesn't go up like that all the time. It's always spiking. Do you understand? Do you guys understand what I'm saying?
Yeah,
Yeah.
we do.
Yes.
So it
And so
means you
that's
should
what
eat three
happens with
meals
insulin.
a day.
You should eat 3 meals, not three like heavy meals, but you should eat 3 meals.
Yeah.
But one thing that I've noticed, and I don't know if you like when we are doing fasting, right? Unless you when you break your fast, you're breaking off your fast, it's like you're resetting your whole body system again. But usually when you're fasting and you want to break your fast and you don't overdo it to the fast, the first 2 days you feel like you die. Like I'll have withdrawals and like my brain will just collapse. I'll die. But then as you continue to fast and you start breaking your fast with small, small meals, your body gets used to it. That is the way our body is. You don't need too much to get your body to work. And I think so that we think that we need to, or I used to talk about I'm allergic to hunger. I don't like being hungry. I feel like if I get hungry, I'll die. But you'll be fine. Like you'll be completely fine. But we overload our system. And so that one of the reasons why we also get so hungry is because our insulin is just shooting and then it will shoot and then after that it will drop. Then you shoot it up again and then you drop. Then you shoot it up, the kind of foods that we call snacks, and it's the same thing we do for our kids as well. We overdo it with our children. We overfeed our children. We are not giving our children good food. And then they will end up having, all of these issues that it takes the average when somebody has a heart attack where their blood vessels are completely clogged, it takes an average of 20 to 30 years for plaque to form. So if the average age for heart attack is 50, it means that from the age of 20, if you are making bad habits, your body is already starting to form plaque. That will increase your risk of you having a heart attack or a stroke in your later life. Heart attacks don't just happen. It's not all of a sudden one day it gets clogged. It takes decades. So the changes that you're making for your life or the decisions that you make in your life and also in the life of your children is so important. The kind of foods we eat, the processed foods, all the Pringles and all the things, the chips and all of those things. And I mean, I do the same thing too, but there has to be like a limit, all the sweets and all of that. They're not good. We are hurting them. We are increasing their risk of diabetes. We are increasing the risk of them having a heart attack in their 40s and 50s. If that is it, it's because some of us contributed and given them the food that they eat now. And now they have made everyone depressed. Sorry. But it's true. And I say it with love because I think that there are things that need to be said that people don't know. Some of these things you assume that, oh, everybody understands like why should I eat healthy? But what exactly does it mean? What does it mean to eat healthy? And sometimes you'd be surprised, like in that part, like, I don't know what it means. Or like am I even things like Maggie Cube? Do you know that Maggie Cube, I don't cook with Maggie Cube in my house because Maggie Cube has an ingredient in it called MSG, monosodium glutamate. MSG increases risk of cancer. So they've actually realized that the reason why a lot of Ghanaians, Nigerians, and things have a higher risk of cancer is because of spices like Maggi cube and things that we eat. If you go to the US, you won't find Maggi cube. You won't find Maggi cube in Europe. You won't find it in European stores. You find the Ghanaian stores and stuff, but you won't find it because they are very, very regulated. In Ghana, our FDA, I don't know what they are doing, but they don't regulate a lot of these things. When people are bringing all of this into the system and things, so you have to almost do your own research to figure out what is good and what is not. It's not everything that is there that you have to eat. The place has become very quiet. Too. Nobody's saying anything again. So there it is. So I think that for eating healthy, it's reducing those portions. Those portions of food play a very huge role, especially the portions of carbohydrate. You will get full, right? I'm not saying that you should eat a smaller plate and don't eat as much, but if you fill it with the veggies and the protein and things like that, you still get full, but you're now filling yourself with healthier food and fuel that actually helps do what it needs to do. The thing with using protein and vegetables and things is that your body, if you take 1 calorie of protein, your body has to burn more fat in order to digest protein. Right. So, in a sense, even though you're eating protein, you are burning fat in a sense because your body has to burn more energy in order for you to do that. And so it makes it more healthy, so especially for people who want to lose weight and things like that. Any other questions? Wow.
Should they use Maggi to cook? What should we
Maggi is
use to
not.
cook?
I don't use it.
Because there's a way
I don't
that
use
you don't
Maggi.
put Maggi in the food. It's like, especially if you use it all your life.
It is an acquired taste.
It's
an acquired taste. It's not that you don't need you can. So this is the honest truth. When I came, I told the lady I in my house, the lady that helps me and I said I don't cook with Maggi because she brought Maggi to my house. I don't use Maggi. I only use natural ingredients. I only use ginger, garlic, pepper, salt, and once in a while, maybe if I travel to the US and things, I'll buy like specific seasoning because I read every single thing. And if I read it and the ingredients are difficult for me to pronounce, I'm not putting in my food because they have too many preservatives. And it's, of course, an acquired taste sometimes. So a lot of times I will use the fish and the dried shrimp and things if you want, that Ghanaian taste. If I'm doing jollof, I'll tell you, use corned beef. If you're using corned beef, don't put salt because corned beef already has too much salt. But then at least it will make it feel, the thing is there. And I mean, it tastes good. It tastes good. That's why we have ginger, we have garlic, we have we have salt. We have all of those things. We have to go back to the basics. The Maggi and things, they've helped us with our food, but they are not helping us. It's not healthy. It's not healthy.
How
It
did we
increases the
get
risk for
here?
cancer. How did you get to it?
Here.
In what sense? How did you get
all
to
the
it?
spice on the market have the MSG
I don't
thing.
think all the spices. I think that we have a lot of like natural spices but I think that I just pay more attention. I'm not somebody, and me and my husband, we are not people that are very big on. It doesn't need to be so. Some Ghana, they need
Tasty.
they need seasoning. I'm not that kind of person. I've never. I mean, I like good seasoning, but I'm not somebody that I need to taste whatever taste in order to. So I learned how to cook with other things to give me, sweetness. So I'll use like green pepper. If I want sweetness, I'll use like the sweet green peppers to get sweetness in my stew. I'll use carrot and I'll blend it, and I'll use ginger. And I've learned how to create flavor with natural ingredient. I just had to learn it over time because I was like, apparently everything around me wants to kill me. So at this point, what do I do? Like, how do I? live my life the way I want to
Oh
and things
Lord.
like that. So if I'm doing contomere, I don't do the only seasoning is
But
literally like a smoked fish. And even that one, I tell her that please, you have to be careful where you're buying the smoked fish from because I don't trust these people. So it's that it's an acquired taste, but you have to learn because if you don't make those changes, you're slowly adding to hurting yourself in the end.
Sankofa spices, they are really natural.
Yes,
They
and I'm sure
smell
they are.
like
So that's the thing. That's what I'm saying that
the
I mean,
natural.
sure there are some companies, and especially the Ghanaian like what is it, how do you say Ghanaian companies that are actually making those spices, like Mega said, they make some very good spices. There's some people that make some really good. So you
Yeah,
have to
red
put that
meat is not
energy
the
into
best,
looking
but
into it and
Sankofa
see,
really good.
yeah, and see what they have. And so sometimes that's what I will use and stuff. But I think I've become more used to. Of course, if I go to someone's house,
The
I can't ask
natural.
them that. I can't go to someone's house
What
and
did
ask them
you
to
put in
put
your
Maggie
food?
in the food. But most of, at least I know that 90% of the time, what I'm eating is in my house, and I know what I'm eating from my house. So.
Okay.
Dr.
That's
Sumpa,
very
can you use, so since we've already, okay, now we know, so going forward we'll do better. Things like maybe lemon water, you know how they say, oh, like drink lemon water, put cloves and cinnamon and like, those concoctions. Do they help in any way?
Yeah, they can help. So lemon is a very good way to cleanse the system in a way. It just helps to, clear your gut and, get, digestion starting, like your gut gets it to wake up. Cinnamon it's also good in managing blood sugar, not like in treating diabetes, but it helps to, what is the word?
regulated.
Regulate. Oh, yeah.
Yeah.
So sometimes what people do is that maybe they'll drink like lemon and cinnamon like in the morning. It just gets your body to wake up a little bit. But one of the
Yes,
worst things you
you
can do,
can
like
turn off
in
the
the
light
morning,
for me. Thank you.
usually when I wake up in the morning, unless like I am hungry because I was not good and I ate. Because if I eat after 8 o'clock, I guarantee I'll wake up and I feel like I need to eat an elephant. I get so hungry. And so I try not to do that. But if like maybe my husband came and he was eating some check, I'm like, well, let me taste small. The next I
The Maggie.
lay that Maggie in that check. So I in the morning usually I will have a cup of coffee without sugar just to get like my, and I've also noticed that if I just have something small in the morning, I don't get so hungry. Sometimes the problem is that you wait so much and then you're hungry, you start making very bad choices, because
Yeah, it's
when
true.
you're hungry, everything needs to enter your mouth. But if you're able to regulate that hunger, I remember I used to be the person that was like, breakfast is the most important meal of the day. I need to have toast, eggs, sausage, bake. Like I need to have something. And now I can't do it. I only have coffee because if I do it, I feel sick. But you have to teach your body how to do that. You have to teach your body how to, not always want to eat these heavy meals all the time. But those drinks, I mean, they don't hurt. It doesn't hurt to do that in the morning. For me, I like coffee, so I've tried those drinks. They work out, but sometimes I'm like, I feel like I'm just drinking medicine. Like I can't, like I just can't. But it works well for people. People who do like maybe like ginger tea. Ginger is also a very good gut awakening, spice as well. Ginger tea is really good, or just ginger that you cut and put in water and stuff. So there's nothing wrong with those things. If you guys are interested, I can show you because there are some recipes I send to patients who are trying to deal with like managing their blood sugar, their cholesterol. I give them like morning drink recipes and stuff. So if you're interested, I can send something on the page so that you guys can look at it and see.
Wonderful.
Look, I was going to ask a question, but I mean, I've answered myself because this one that watch and Banku cries. When the coke near Avaro, there was a journey because
Oh,
at this
Coke is
juncture.
so bad. Coke
Hey.
is so bad for you. Coke is like battery acid. Coke is so bad.
Oh, Sumpa drank Coke today.
Even the diet coke, even the no sugar coke.
Diet Coke. That they said no. If it's no sugar, why are you tasting? What are you tasting? What makes it sweet?
It's your friend is saying
It's what?
sweetener.
It's sweetener. Okay.
I had this argument with a friend who's
Oh,
addicted. She's genuinely addicted to Coke. Like
Yeah,
she has cans of it in her
yeah,
fridge and she cannot
yes.
function a
It
day
is
without it.
very addicting, and the
Yeah.
addicting part is the sugar and also the aspartame and the other, if you want to read the back of your Coke, just for fun, take a Coke thing and read the back. And when you finish reading the
Lady
back,
Senna,
let
let
me
the
know
coke
if you
go
still,
away.
and when you finish, read the back of the Coke and then text me and let me know whether you still want to drink the Coke or not.
They'll drink OSW.
Let me
Maybe
text.
once in a while, a
Hey.
loud while.
Let me see. I always forget how much sugar is in a
Hmm.
can of Coke.
hmm.
Good.
So look, it said
So,
a standard 12-ounce can of Coca-Cola, right, contains 39 grams of sugar. That is approximately 10 spoons of sugar.
Hey.
10 spoons.
10,
Once in a while.
once in a while. Okay. So this is 12 ounce. 12 ounce is the standard. Now, if you get a 16 ounce, 16 ounce has 52 grams of sugar.
hmm.
A standard bottle of Coke, standard bottle, that's a 20-ounce bottle, 500 ml bottle of Coke that we drink, has 65 grams of sugar. That is 16 spoons of sugar. People are quiet. So if you want, you can
People
continue
are
to
in
drink your
shock.
Coke.
People
Please,
are
that
in
picnic,
shock.
the people who have bought the Coke, please return it
they
to the
have it. They
people.
have it in their kitchens and things. They don't know what to do with the Coke after this.
Dr. Sompa, what about juices? Because I
Yes,
don't
I was
I'm
drink
a
gonna
bit
fizzy.
confused though.
I don't drink fizzy drinks. All I drink
who
is the
is
juice.
Yes,
So
I mean,
what
confused?
I
about
don't
Says
drink. I don't drink. I
those of
don't
us who
drink
drink the juice?
soda. Yes, so there's nothing wrong with drinking fresh fruit juices. There's nothing wrong with it.
Okay.
Even for juices, especially if you're somebody that has like diabetes and things like that, not every
Mm,
fruit is good. A lot of fruits are not good just because fruits are very high in, like mango.
in
I
sugar.
love mangoes, but mangoes have a lot of sugar, right?
Yeah.
So if you have issues with managing your sugar, then drinking mango juice is not the best for you.
Mm-hmm.
Oranges also, when they are very sweet, they have a lot of sugar. So I love fruit juice. I do a lot of juicing because it's much healthier. Yes. Yeah. Because it's much healthier than, the juices and what we call fruit juices and stuff. But definitely having juice is better than, having soda.
The fizzy. Mm.
Yeah. I
Hey,
think
hey,
Mommy has
yes.
a question.
Mm.
Wow. Anything
My
else?
sister should come and listen.
Mommy,
So, Dr.
you don't
Sampa,
taste that much sugar in the drink. That much sugar in what drink? In the Coke.
the coke.
You don't taste sugar in the Coke. Mommy, did you say that you don't? Did she say she doesn't taste the sugar in the Coke? Is that
I
what
have
she's
to
saying?
book a session for her, so you check her sugar.
No, what I mean is like this 16 grams, 16 spoons. Spoons.
You have you ever?
I don't
It
taste
is a
16
lot of
spoons
sugar
drinking the drink.
in the sugar in the Coke.
Yes.
You don't taste the 16 spoons.
Yes, like it just tastes sweet, yes, but then you don't see that impact of so much sugar
And it's
being
because
taken.
so are you someone that drinks Coke a lot?
Pardon?
Are you someone that drinks Coke a lot?
No, 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 no.
Okay. So I think that it depends on what you are used to, right? Because you become accommodated to high sugar if you do a lot of high sugar drinks, right? Like so
Mhm.
when I was pregnant, I loved Coke. I don't drink Coke. I have not drank Coke in like since I was like 15. I stopped drinking Coke. But I don't know, for whatever reason, when I was pregnant, that is all I wanted because I couldn't eat anything. I felt so sick. The gas was up. I could drink, like, I would drink Coke and I'm like, what is happening to me? Because I know this thing is bad. But that's all that my body wanted. Then I had my child. And then I was like, oh, Charlie, this Coke, when I put it in my mouth, I literally took a sip and threw it away because it was too sugary. I can't do Coke. I don't do Coke. I don't do Fanta. I don't do Sprite. I can't do soda because it's too sugary. It has a lot of sugar. But then it's because I don't drink sugar, right? So if you are used to it, it feels like, oh, maybe it's nothing, but it's a lot of sugar. It's 16. That's what it says. It's 16 spoons of sugar.
What about
16
Malta Guinness?
Okay, let's do research. Let's see. In a bottle of Malta.
I have to call the company and report Dr. Sumpa to them.
So it says a 33 ml bottle of Malta Guinness typically contains 36 to 37 grams of sugar. This is equivalent to 8 to 9 sugar cubes.
The mouth for that.
So malt is maybe like half. Maybe is it like about half?
No malt. Picnic and for malt and quambra ho. Person will cook.
It also has about 14 to 16 grams of carbohydrates. So malt is very high in carbohydrate.
Baby, you choked. What are some? Yeah. Yes. Yes,
But Dr. Sumpa, is it that we should avoid it altogether, or maybe we can take it in moderation? Me and
I think
just
please
wondering.
please give
Hey.
When you're fasting.
Because it looks like everywhere, because the Maggi, even if you don't cook with it and you're eating, Otowachi Maggi wom. If you buy food outside, this one. And the blue band, even if you don't use it in your bread, the pie, the pastry, everything,
It's
that's what they
true.
bread.
Yeah,
Even
it's
bread they use it,
true.
that's what they use though.
Yes,
So
Because in
literally,
Ghana, which baker would use
yeah,
butter for bread?
yeah. The smudging is what they use. Then
I
the
hear
bread they
some even
pottery.
use oil.
Eh.
Yes, that's what I hear.
Yeah, it's
Charlie,
true.
you've been hearing things. Yes,
No,
your
but
sister is
you'll be
back here.
surprised. It means that we have to avoid bread, pastry, just because the margarine, that's what they use, those buckets of margarine, that's what they use for bread.
I wish I was born in the Old Testament.
Wow, shit. Then you'll be eating manna.
I'm eating manna. I won't face this thing.
Unlimited
Hey,
bread. You'll be eating unlimited bread.
on
Yes.
living bread. I think we need to start doing that. Hey.
They say even the butter is full of oil.
Mado, let's diet. Why?
No. Obi and fasting. That's why a
I wanted
woman
to
now
even
are
ask
fasting.
about pork.
Say 3 days,
Is
be 1
pork
week, be what fasting, and clear your guts and everything of all
of
these
the bad food?
toxins. Because fasting
I
it
was going to
also
ask her
helps the
about pork.
body.
They say
Hey,
pork is good fat. They say we should eat
Ewu.
protein.
Hey, pork there. Bobo. Hey, you didn't hear.
I want a pork as some.
Won't say pork.
And the pork are any.
Yeah.
SW
Yeah,
for
Clean.
this is. Yes, that
Domedo.
pork need you. Nye.
Sir?
Fat a
hey,
womb. A
one
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 womb.
say it.
Hey.
So the pork, You know,
Mr.
when you
Dodo
grill it,
has
say oil no be na
say
negujani.
preaching our preaching was that way. When you listen to it, crowd be small. Come in.
You say,
Hello.
Prefono or what kind he
Sorry.
doesn't die.
Just checking
When
your
you
bed
say,
real quick. Okay.
do you guys know
Yep.
when the
Thank
pig
you.
is bitten by a snake, it doesn't die?
Because of the fat.
Wow.
Hmm. The Lord will take care of us.
Amen.
And they eat anything and everything. Apparently,
So
they
Shu,
can
have you
chew a
stopped eating
baby.
the
They can
pork
chew.
and there's not
They can
Kanishi there?
chew
No?
human when they are extremely hungry.
Shu, not Kanishi pork never a this one. Where idea na?
Oh, they are going to your
Unko ye dedi o. Robin ye
Auntie,
dedi.
auntie.
Hey, big
Ye
feet
di cry
pa
ye di life amanyame.
when you
Baby,
pig feet
every
pa and
baby,
nice soup.
every day. Baby, every Maggie, so yeah, baby, give me a
Big
bee.
alive.
Father, forgive me.
Maggie
I'll
need
eat
the
it in
bed, you.
small
Maggie
portion.
need the bed. See. Hmm.
Oh, but I think the
Really?
Maggi, you can do something about it by using the
Saying that
natural
the
spices.
quantity, I was told that a certain, so I think I was, and again, I think the best thing is to avoid it, but if you can't avoid it, there's a certain portion of soup that you have to put, and yes, maybe I will yes to top of one be, then you put one whole like cube of it becomes concentrated, but maybe if you are doing like a big pot, and maybe you put one, I think I watched the video that was kind of showing the quantity of Maggi you should put in a certain quantity of food. So literally, like the less the better, or something. I mean, the best choice is to obviously get rid of it. But I think say maybe say I don't know if I'll be able to stop altogether. Maybe I'll reduce from one to half and then I eliminate.
Restaurant today you see A1 you.
Hey.
Mm,
Hmm.
hey.
Yeah, some more.
Because
Hmm.
I
Let's
know
come up
a
with a
caterer
solution.
who mixes Maggie and A1 when she gets order.
All the
Mm.
caterers use it too. The wache people, that's what they used to cook the wache. Wache na that's what they
Your
use.
watch in the house.
Sure, if you go to the work every day, how will you cook your watch every like sometimes it's tough. Sometimes
Cook
it's
in
tough.
the
It's
house.
tough.
Dr. Super, you
Yo.
have
Hmm.
Yes.
caused chaos and panic.
I'm telling you.
You have caused nightmares this evening, Irande.
No, but we know that as some part the truth of the matter is that everything you said, it's not like we didn't know. We know. We know.
Know
We
how
know.
when
Maggie
my
is not today that we know.
Maggie runs out and I'm fighting with my husband. Now one to Onga number. Meda ye kwano. Hey, I'm like, what one to poison number. Irande.
Oh, but Onga is better than Maggie Small. You see.
Susumpe.
Dr. Sumpa is Onga better than Maggie.
I honestly have not checked what is inside
Onga,
Onga, to
please
be very
check. Since you have checked Malta Guinness, check Onga.
It is not good, oh, madam. Obafemi, it's not good.
Dr. Sumpa, someone was talking about pork meat. Is it good or bad?
uh, oh,
This thing is warning
Onga has MSG in it.
Mm.
Yours, man.
Please, what
Mm,
about the pork?
let me see. Let me see. What is in
you.
It's a
Onga?
Oh,
muddy pork na. A
Mm,
tray. Hmm. Eh, you free
yeah,
baby, and I'm the co
Onga
baby.
has MSG in it. Now, so pork, it depends on. So when you say pork, I talk about like the pork, the feet, the pig feet.
The pig feet,
The
the
whole
The
meat, no.
It's
whole
bad.
entire
Listen, ladies, like let's be honest. When you eat pig feet, what are you eating?
Hey,
you see
the
the bone
sweetness is in
marrow.
the bones. The
wow.
bones, you know.
Oh.
So you're not eating the salty, that meat
No,
that
no,
has
you
salted, that is
took
high
it.
fat. The
No,
tolo beef
no,
things
no.
that has so much
Oh,
fat in it and so
jeez.
much salt.
Hey, Dr. Sumpa, I like Tolobifio. What is wrong with you
Eh,
today?
you stop eating.
Why?
At this
I'm not
juncture,
coming
just close your
tomorrow. I'm not
kitchen.
coming tomorrow.
Then stop eating. There's so many other things you can eat. And the reason why we
I'm not
struggle is because
coming
that is what we
tomorrow.
have been raised to think that is normal for us to eat, right? Like as if if you don't eat that, then something will happen. Nothing will
The
happen to you.
Israelites were eating all these things.
And then they after that they're in the wilderness for 40 years and we're eating just manna
Yeah.
and quail.
So we can't eat Tolobifi too.
So beef
Hey,
has a lot of salt. I'm not saying you shouldn't
No.
eat it. I'm saying that you shouldn't eat it all the time. It's moderation,
okay,
right?
okay.
If your diet is high in all of these things all the time, you're increasing your risk. But you have to just be very aware. Now you are aware. Now you know.
Yeah, that's true.
So now you're aware. Now you know. Do with that information as you will.
Yeah, yeah.
So the pork, you said they can eat it, eh?
Pork feet, pig feet is bad. Pig feet is
The
not good.
feet is bad.
Yes,
The
pork. Because
entire
like
The
now there's
the
something no because
entire
like,
thing.
there's some part of the pork that is of a whatever that is leaner meat, right? But a lot of us when we are eating pork, we are eating so like the pork when they use it for kebab and things like that, it wants you to bath them, yeah. That meat is it's the bathroom. Or maybe throw it away, to be honest. So the pork meat, like that kind of like suya pork meat and things, is more lean. You see, when you look at it, that meat is more white. Have you guys noticed? When you look at
yes,
like the
yes.
suya meat and things, that meat is more white. That is healthier meat. The white meat is leaner and is better. But the pig feet, where we are chewing and is all, I don't know what it is that we are chewing, the fat and it's salty and all of that. That one is not good for you.
Hey. Okay.
Prakunchar. Stop eating prakunchar.
Hmm.
Yeah, some more.
So yeah, so that's
Yeah, so
the
Dr. Sumpa, I learned that when you are eating, like you said, you should have vegetables, protein, and
mhm,
then carbohydrates in portions. I
mhm,
learned from a health expert that you
mhm,
should first take in the vegetables and then
mhm.
take in the proteins and then take in the carbohydrates. That when the vegetables go in first, they help to, clear the guts and things, get things in the right places so that when the proteins come and then the carbohydrates come, they can absorb them and then, you know,
Yeah, it's not necessarily they're getting things. It's just because if you eat the vegetables first, they fill you.
okay.
Yeah.
Oh, that's the only reason?
So you can, yes, so it fills you. It's because you are filling with the more healthier meal first. That by the time
Healthier.
you get to the
Yeah.
carbohydrate, you are too
You'll be
Yes.
full to eat too
satisfied.
much
Mm-hmm.
carbohydrate. It's not necessarily because it's not opening your gut or doing it. It's just that it fills you more. And
Oh,
so that's why people say that you should do that. I don't because I like to mix food. I don't like to eat food in comparts. So if that's how you want to eat, that's fine. But I think that also if you divide your plate well, then it wouldn't be an issue either.
okay, last one. You talked about us eating a lot of proteins. So what kind of
Mhm.
proteins are you suggesting?
So lean proteins are good. I think any kind of protein. I think that when you start telling people that it becomes a hot topic. So of course, chicken, seafood is very good. You can eat beef, but if you eat beef and goat meat every day, that dark meat is not as healthy. It's because look at when we cut our beef, look at all the fat that surrounds the beef and the goat meat.
Hmm.
Very high fat in them. That's the best part, of course. That's when you're like, Charlie, that juicy fat.
Yes.
But all that fat is not good. But if you look at things like chicken, fish, seafood, crab, they have less fat surrounding them. They are leaner, healthier meat.
Oh, okay.
Mm. The seafood too. We could be almost some milk, also. Hey. Mm.
So we can eat goat meat and cow meat, but in
In
portions.
moderation, yes, yes,
Moderation.
yes.
Little portions. Oh,
Yeah.
okay. Yeah, Tia. And what about oil? Cooking oils.
Oil, I think that, I mean, to be honest, I think that there are different ones that are not, but I think that reducing of all of them, if you reduce the amount of palm oil that you use, you're fine. You don't need to use olive oil. I know that's what people say, but I'm like, honest, at this point, we should just be cooking with air and cooking food in the sun and let it cook. Like, so I think that of all of them, palm oil is the one that, has the most issues. So if you reduce that palm oil content, it should be fine.
So we should do
Um,
regular oil, vegetable oil with contomere and all that
I mean, you
instead of
can
palm
do
oil.
contumely. No, you can use palm oil, but how much palm oil are you eating? How often do you eat contumely? And how there's some people that all their stew they use palm oil. There's some even when they're doing regular stew, they use palm oil to do their regular
Even
stew.
jollof.
Yes,
mm,
they use palm oil for everything. Now that is not good, right? But if you're doing it once in a while, it's fine.
Yeah, some more, Dr. Sumpa. Yeah, it will
Just-
stop eating for you, okay? It will stop.
I didn't say you should stop eating.
No.
But sorry, it's running. I have to go and get the
Yes,
kids
yes,
ready.
yes,
It has
yes,
been
yes.
like a
Doctor,
pleasure.
one last question.
Yeah.
Hey,
Please, if your womb is removed, your uterus, if it's
Mhm.
removed, does it mean you can't menstruate again?
Yes.
Okay.
Yeah.
So if you are bleeding, that means there's a problem somewhere.
Yes.
Okay. Okay. Thank
Yeah.
you.
Yeah.
And
Very.
Dr. Papi, before your question, I'm trying to sign. I've gone onto the website and I've seen
Uh-huh.
the schedule an appointment, but
Uh-huh.
the number is not allowing me. So I want to put a note because obviously my number won't be like
Yeah,
a
that's
Ghana
fine.
number. So I don't
That's
know
fine.
if
That's fine. You
okay.
can put a note, yes. If not, I will
Okay.
also let me give you 233-256-0674. So you can just also WhatsApp us. This is the
Okay.
number.
Let me take the numbers from. Oh,
So
great. Okay.
yes, so that way you can just use that WhatsApp and just say, hey, I want to schedule an appointment, and then they'll reach out to you.
Okay. All right. Thank you so much.
You're very welcome.
So I can ask for you in particular because I want to believe there are
Yes,
other
yes,
doctors.
yes,
Okay.
yes, yes, yes.
Okay. All right. Thank you.
Okay, Megan.
yes, one last question. Someone is
hey.
saying that pig fat is good fat. Is it true?
Pig fat.
And our pork fat, is good. Let
It
me read
is
the question
fat.
again.
You can't eat
Yes.
coagulated fat and say it is good fat. It is not good fat.
Mm.
Animal fat is not good fat.
Uh-huh. Pork fat is good fat.
No, it's not.
Uh-huh.
Hey, pork the asembeba.
Kadiaba. All right.
Everything in moderation.
Everything in
Yes,
moderation.
yes.
Yes.
This evening we have
Moderation.
camped Lady Sumpa too much. Let's let her go. Lady
Yeah.
Today,
Sumpa,
I
God
think that
bless you.
please don't have night. Don't go and your husband wake up the next day. You've removed everything from the house and
All
clean. You have
our
to keep them.
Maggies and things
You
have
need
to
to give
go.
them heads up. You have to have a family meeting. At
We
least give
have
them
to
to April 1st.
emergency family meeting.
Give them to April 1st and say from April 1st, things have to change in this house. So prepare yourself.
Charlie, now we'll buy shrimps and herrings powders and use them.
Exactly. Exactly.
All
That's
right.
the healthiest way to go.
All right. Thank you so
Because we
much,
have to
Dr.
do it
Sumpa.
again so that we
Yes,
can
yes, yes, yes,
ask
yes.
questions. I
We,
can send you
we,
some resources. Yes. And those
yes.
coming tomorrow, I am excited to see you all.
Yay. Please,
Yeah.
if you haven't booked an appointment with Dr. Sumpa, kindly send a message to Lady Naya, myself, or Lady Sally, so we get you booked up so you can go and see her for any consultation except drinking Coke. She won't give you Coke at the
Except
hospital.
drinking coke or eating pork fat. That one there will
Yes,
not.
so yeah, she won't give you that
Mm.
there. So tomorrow, some of the ladies are going to the hospital to see her and get themselves checked out, pap smears and physical checks, mental checks, pelvic checks, everything you can think of.
Yes.
So
And
if you
then
haven't,
also
uh-huh.
those who are coming tomorrow, And we are also doing biometric screening. So we are checking your body fat, your body muscle mass, your water weight. So those of you who need to fast tonight to prepare for tomorrow, prepares. But all of you, so when you come, we'll check, your water weight, your fat percentage, your bone mass, and all of those things. We'll check those out. Or I shouldn't have said. It's better I'm
those
telling
who are
you
not
now.
coming tomorrow want to come and join us. Please, we have already booked up.
Oh, you can come. You can still come. Just let us know.
See, Dr. Super likes to pamper you people. All right, my dear. Thank you so much for tonight. It's been insightful, and we are blessed to know that we have to stop cook and Maggie.
Go and throw all your cokes away and your
pork.
malt. And what else? And your Fanta.
And hey, Fanta also count. Yeah, but we can drink malt.
Sprite, Coke,
Malta Guinness.
Malta Guinness is less, yeah. But Fanta also has about 14 sugar cubes or over 10 teaspoons of sugar in it.
Obviously, God bless you, Doc. Me, I'm a Malta Guinness person, so thank you for being on my side, Dr. Super. God will bless you for endorsing
I know your
Malta
side.
Guinness.
I just said it is less. I didn't say you should drink malt. I said it's less than the Coke.
You know what? Pick a side. Pick a side.
Well,
I am on the side
has.
of water. Me and Megan, we are
juice.
like water or nothing at all. Or Megan.
Wow,
What about coconut?
And fresh.
Coconut water is fine. Coconut is fine. Yeah, coconut water is fine.
And the coconut water, even.
All right, that's God bless
Once I
you so
see
much.
Coke, I'll close my eyes.
This,
you.
Dr. Sumpa, I can post this, right? This
Yes,
session.
yes,
Okay, because I'm sure it will benefit us a lot. And they will have to go back and listen. All those who are still not convinced. Roberta Hammond, no Coke.
And I'll send you some of the things Roberta, some of the things you can drink in the morning, some of those morning tonic drinks and their
Please
benefits.
don't send just Roberta. Send me, I'll put it on the page.
Yes, I will send it to you to put on the page. Okay.
And even that they'll pay a fine.
You want me to also add the things you shouldn't eat and what they'll
add
do to
everything.
you?
Yes, please.
Add everything. When the day before the picnic, I'll post it there.
Then this picnic, they just have to do stir-fried vegetables and
no.
Yes.
And everybody should bring cinnamon tea and come and drink it there. We'll bring hot water. Hey, dear. Dr. So you are spoiling everything for us. The things we have planned for this picnic. Why?
They said the Easter crowd, the cook now, but crowd now use it to my drink so short. I'm going to give it away.
Vachovi. Oh, God. Sometimes it's good to have all this knowledge, so we can shape our lives. The Bible says our bodies are a temple of God. So whatever goes in, we should be mindful of it. So amen.
Amen.
Thank you so much, Dr. Sumpa. Lady Adobia, can you give us a quick prayer so we can end the session?
Doctor.
Okay, please let's pray. Our Heavenly Father, we thank you for such a wonderful evening. We give you all the praise and adoration. We thank you for such an insightful meeting. We pray that we'll be doers of it. Father, help us. We need your help. If you don't come in, we won't be able to do it. Father, please help us. In Jesus' mighty name we pray thanksgiving. Amen.
Amen. Help with dear Lady
The Father,
Adobia.
please help us. She said it plain to you. This is why we need a gift of God to get us through.
Needs help.
Father, help us. Oh, Father, help us. We
Father,
beg.
help us. Father, help us. Thank you all, ladies, for coming. Tomorrow is Bible studies. Let's try and be on time and study the word of God. God bless you, Dr. Sumpa. God bless you so much. Ladies, let's bless our sister before she goes.
God bless you, Dr.
You're welcome.
It's a
Take
free
care.
consultation. Nyamisha will be brave. And we'll see you tomorrow at the clinic. All right then.
Bye.
Have a good night, everybody.
You
Bye-bye.
too.
Good night. Bye.